The opioid epidemic is a growing problem nationwide.
An average of 5 people in Michigan die from an opioid overdose every day.
That's why we are taking steps to protect you and all of our patients.
By using MAPS, the Michigan Automated Prescription System, to better navigate your diagnosis, treatment, and care.
MAPS is a tool used by health professionals to help us make safer, effective, and informed decisions. When a patient is evaluated, we can use MAPS data to access their controlled substance prescription history. This real-time data will help us protect the patients and end the opioid epidemic.
We are seeing too many people who are dying from opioid overdoses. We're also seeing too many children that are orphaned because they've lost their parents to this epidemic. MAPS is very easy to use, and everyone should demand that their physician knows what other medications they're on before they prescribe a new one. That's your right. And that's why MAPS is so important. By checking MAPS, physicians are working to help end the opioid epidemic.
For my patients that request opioids postoperatively for pain management, I'll query them in MAPS. It provides a lot of information on the number of prescribers prescribing for the patient, the types of prescriptions, the pharmacies that they're going to, the number of aliases the patient may have, and those are all red flags that they're possibly having an addiction problem. So if I do see red flags, it gives me the tools to find out who the prescriber is, and I can contact that prescriber, and then we can kind of tailor their treatment after that to deal with that possible issue. Younger patients that I see are usually opioid naive patients. In other words, they've never had a prescription for an opioid. So I'm usually the first person to give them a prescription.
I've been on both sides of the opioid epidemic. A few years back, I had femur injury, which led to excruciating pain. Post-surgery, I was on opioid prescriptions. Even as a provider who was aware of all of the medications, I was finding it hard to navigate through that. It gave me a different perspective altogether. I understand both sides of the story. Providers want this epidemic to stop, and they want to be part of the solution. And MAPS helps providers to do that.
I care, I check.
I care, I check.
I care, I check.
I care, I check.
Together we care and check MAPS to protect patients and prevent opioid abuse.
To see what Michigan is doing and how you can help stop the epidemic, visit Michigan.gov/opioids.